Hey, Wendy and Dr. Lindsey here. We're going to take you through a real quick video on a fairly uptight lawyer who was almost so uptight that we didn't offer to work on him, but who has subsequently become my daughter's favorite patient, and he's been a real good fellow to work with. Just like a lot of lawyers, kind of uptight when you first meet him. And so he came in and he looked like this. And although I think that's a big problem, you were more optimistic than me. But I mean, he's cursed with kind of a big head and a limited amount of donor hair, and the donor hair is relatively fine, not terribly fine, but relatively fine. And worse yet is that he's so fair-skinned and his hair's dark, which will improve as he gets. And so we did 2,400 grafts, I think, on him, which is all that his strip would yield, and that got him this result at a week. And then here he is at 3 months, and here he is at 6 months, and then he walked in last week at 9 months and did this video. All right, we're somewhere between 8 and 9 months out of a guy that's now become one of our favorite patients, and he's a lawyer, got it in the public eye. Bend over one time, please. And I have a picture of your before picture up to your right. So, I mean, you're really growing quite well. Let me just put my hand and. Your curse is you've got such a color contrast, but as you get a little gray in you from that lawyer, and that'll take care of itself. And so at 8 or 9 months, I think you're 3/4 of growing. Spin around and face the blue wall, would you please? And your scar, I haven't even looked at that yet, but let's see. It's a pretty good little scar. That numbness go way back here?
Yes.
And look up at the ceiling, please. So if we do another case, and I think we're going to at some point, we'll start here and work as far south as we can, and almost certainly put a few singles at your hairline. Spin back around. Was that up front with you? Any issues?
You were fully transparent about every aspect of the procedure, and your recommendations have been completely accurate.
Great. And as I told you, one dude a year goes crazy from that numbness in the back of the head. It's always an uptight lawyer, like I expected you to be, but you turned out to be one of our greatest customers ever.
It's a good thing you're a surgeon and not a psychiatrist.
That's right. Yeah, I just did some psychiatry a few minutes ago on somebody else. All right, anything you want to tell these characters that might look at this?
Oh, I just look straight up, so you can edit that out. I would use Dr. Lindsey if you have any desire to see improvement in your hairline. I have absolutely no hesitation about recommending him to anyone. He's an exceptional surgeon, and he's fully transparent about all aspects of the procedure.
All right, man, thanks. So what do you think, Wendy?
I like how he looks. It doesn't look like a hair transplant when you see him personally.
Right, yeah. I mean, he definitely looks worse than that sterile lighting in front of the blue wall.
Yeah, you have very bad lighting, but he does. Personally, he looks really, really good. And when you look at the video, only when you do that, you look at him, it doesn't look like a hair transplant. It looks really, really, right. He looks really good. And
I know his social scene's gotten better, and I think he's getting ready to maybe get a new job or promotion.
Oh yeah, he is.
And I think he picked a day in September for his second case.
For our second case.
Yeah. So this fellow's got it right. Do your research first and just be patient. And if you have questions or issues similar to him, please give us a call.